So basically, you can see right there what I'm setting that up for is the workshop on trigger points. You can also, if that's uncomfortable for you or you're not doing the workshop, then you can always use the conversation about getting them there for the finances. However, I'll just tell you that some women think they're independent and they're really not, meaning they think that they're going to be able to afford it or make the decision on by themselves, and then they get down to the finances and they're just like, well, I need to go home and talk to my husband. Well, that's the exact reason why I wanted him here to begin with. However, with NRCT patients, what I find to be really true is that because they're so messed up and their husband probably already had so much involvement, it's kind of easy to get the spouse there. You could just simply say to them, listen, you've been to so many different doctors, and what we're going to be going over is nothing that your husband's ever heard or seen before. And it's going to be very important for him to be here. That's one of the reasons why I'd like him here. The second reason why I'd like him here is because, I'd like to save you money. And then you can go right into that script that we just went over is I'd like to teach you how to do some home remedies. However, you can't work on yourself. So what we need to do is teach your husband to work on you, but I want him to know where the problem areas are before he works on you. So bring him in on Thursday, and that way it'll qualify you both to come into our workshop that we are teaching on Tuesday nights. You're not going to be teaching the trigger points on day 4 when he comes in. What you're going to be doing is showing the problem areas. Make sure y'all all understand that. Is what you're going to be doing is showing the problem areas, so that will qualify both of them to come in on the workshop on day 2. And so then basically you can do your brain-body diagram at that point and then explain to them what treatment and what treatment that you're going to deliver and how you're going to deliver and what's going to be done and the responses that you're looking for. That's what you're going to go over at that point. Do the treatment with them and then schedule them back for the following day. And I know for some of you guys, I know one of the questions might be, so should we charge for day 2, day 3, and day 4? My answer to that is yes. However, if you're getting really successful success rate by not charging, then you could not charge. However, I'll just tell you, it gives it a bigger value when you do charge. So obviously that means you'll have to be billing it appropriately, but you need to make sure that you are doing the charge so that the person has a better value to what it is that you're delivering. So that's basically all there is to day 2. And like I said at the beginning, one of the things that you want to look at is what is the result of your day 2. And so if we go back at this point and we look at, okay, so what are my results? They know that we can help. They know that meningeal compression is the cause of their problem. They know that when their symptoms are treated, that it'll improve or disappear. If they drop out of care when their symptoms are gone, they will still have the underlying cause, and if the underlying cause is still in place, the symptoms will return. And then you have to ask yourself, did we get that? By all that information that I just went over, did we achieve that? And that's what you have to look at with your patient when you come out of the room is, did they understand that, or were they in too much pain and they didn't really get it? Well, if they're in too much pain and they didn't really get it, then obviously they're going to need more than a 4-day process, which means they'll probably need a 6-day process. And that means you're going to just rehab that on the following day. So what I'd like to do now is leave it up to you guys or leave it open if you have any questions in regards to day 2 and what to handle or how to handle it, or if you've come across the day 2 that's been problematic and you got stuck and there's something that you need help with, I'd like to address that. So is there anybody that has any questions?
Christina, it's Dr. Steve Teixeira in Colorado.
Yes.
I think it was in the 4-day report of findings outline that I got off the website. I think it referred to testing, not treating on days 2, 3, and 4. Is it optional or is
you can use testing if you're going to use the test for those 3 days? Then absolutely. Then you're just going to change the word to testing.
Okay.
And then you're just going to bill appropriately for the testing charge.
Okay.
I mean, I know that some people don't charge, but I personally would charge. It gives what you do a better value. Did that
Great.
help answer that question?
Yeah. And then the workshop that the spouse qualifies to attend,
Uh-huh.
you can talk about that at one of the later days?
Well, the workshop is just the trigger point. It's the normal workshop that we go over in Singer Enterprises. It's the trigger point workshop.
Okay.
So it's like what it does is, gosh, goodness, it helps gives your patient more education, and then it teaches them how to do trigger points at home.
Okay.
And so obviously if they're doing trigger points at home, that'll do nothing but help you in the office.
Sure.
And then when you get to day 4, you can add that in and take it away for them paying in advance so that you're really not giving a whole bunch of service away as you are giving a bonus for them prepaying and coming into the workshop and getting that part handled.
And where do I go for information about that workshop?
The trigger point workshop, you're a DSC client, correct?
No, not
Not
at this point.
Not at that point. You can go on the DSC website, the David Singer Enterprises website, and you can go right under products, and you'll see in-office workshop. It's the whole CD, the whole package.
Okay.
And then you can order that, and that's the presentation that you go through.
All right. Thank you.
You're welcome. All right. Does anybody else have any other questions?
Christina, it's Dr. Tashiro again. I've got one more question.
Sure. You can have as many as you want.
Okay. I can't remember if it was at the end of the brain-body diagram. It was some place in the educational process for the patient. You said you asked them a question. It might have been, do you understand? And if they say no, you're in trouble.
Right. It's at the end of the brain-body diagram when you're talking about the symptoms.
And what is the question?
There's a couple of them. But I think the one you're addressing is, can you see that meningeal compression is the cause of your problem? If we just treat your symptoms and we leave that condition in place and we leave the cause in place and you quit, can you see that all of that's going to return?
Okay, great. Thank you.
You're welcome. All right. Does anybody else have any other questions? All right. Well, then I'll look forward to talking to everybody on day 3.
Thank you.
Thank you.